technical issues showing by Zoom. So our IT teams are still managing for that. So first of all, welcome all doctors for the session. I welcome Dr. Anu Beke also. So Dr. Anu Beke is a staff of Kotake Ayurveda. He did his UG in Parsinikadu Ayurveda Medical College and his PG in Samhita and Siddhanta in Government Ayurveda College, Trivandrum. He is still pursuing his PhD in Samhita and Siddhanta from Parul University, Vadodara. He has published more than 25 articles in international peer-reviewed journals and presented papers in various scientific seminars. Currently, he is working in our clinical research department, Ayurveda. He was also a teaching faculty in our Kottakkal VPSV Ayurveda College. So I'm not making more delay. I welcome Dr. Anu for the session. Dr. Anu, please.
Thank you, Jadin. So I think very good afternoon all. We can start. Okay, thank you. Sadurmukha Samarambam, Vagbad Acharya Madhyamam, Tasmad Acharya Paryantam, Vande Guru, Parampara. Am I audible, Jadin?
Yeah, audible. Please carry on.
Yeah. Slide change not occur. Just a minute.
तो भी जारी क्या अभी वहां आज जल्दी मैं भी जाऊंगा
Am I audible now? Hello?
Yes, sir, you are audible.
Yes, sir. Yes, sir.
Okay. In simple words, the blood pressure can be defined as the pressure exerted by the blood on the blood vessel. So the description of blood circulation was first given by William Harvey. And in 1986, the term hypertension came into existence with the invention of a cuff-based sphygmomanometer. So the prevalence of hypertension in India, hypertension is directly responsible for 1% of all stroke death and 24% of all coronary heart disease. And it is the most potent risk factor for disease of the brain, kidney, and heart. And hypertension is a silent killer because most sufferers are asymptomatic. In 95% of the cases, hypertension, the exact underlying cause are still unknown, but it is believed that it is due to the genetic and environmental factors. So the prevalence of hypertension, we can in India, it can be overall hypertensive. This table showing all this rural and urban classification, 25% and 33. And we can see that with controlled BP levels under treatment, 1/10 of the hypertensive population in rural area only getting with controlled BP, and 1/5 of hypertensive population getting urban area getting this controlled BP. And we can go to the next Ayurvedic view of hypertension. We know that in classical Ayurvedic literature, there is no evidence of any disease resembling to hypertension, but we can understand the assessing the dosha, dusha, and srodhas. There are many terms related to hypertension, that is Rektagadavada, Siragadavada, Avradavada, Dhamani Prabhurana, Rektavikshebana, Vyana Adibala, etc. Some scholars stated hypertension as Shonida Dushti also. So in Ayurveda, the hypertension is not a disease mentioned by Ayurveda, but the etymology, embryology, anatomy, physiology, and the pathology of the heart, blood, and the blood vessels have been well expounded by our acharyas. In the Susruta, Charaka Samhita, all classics we can see the blood circulation, all the things we can see. And we can propose that the hypotension is to be understood as the prasara avastha. We know that Shatkriya Kala, Chaya, Pragopa, Prashama, like that. So the prasara avastha, which means the spread of vitiated doshas from their specific sites, specifically the Vyana Vada, which is situated in heart, same Sadhaka Pitta, which is situated in heart, and also the Avalambaka Kaba, along with the Rekta Dushti. That is the stage, I think, prasara avastha of hypertension. We can correlate. Because Vada involvement, we can the neuromuscular involvement of SA node or the things, the neurotransmitter, and all the endocrinal things can be correlated to the Pitta, and the atherosclerotic and the Kabha Meda involvement, that is Avalambaka Kabha, like that we can correlate. And I will tell one by one. So blood pressure regulation on the role of Tridosha. So blood pressure in that term regulated by multiple mechanisms. So short-term neural mechanism include the nervous mechanism controlled by the vasomotor center of the brain and all the autonomic stimulation. So the involvement of prana and vyana vayu we can correlate. And all the hormonal regulation. We know that around 15 different hormones secreted which can create various variations in blood pressure. They are adrenaline, noradrenaline, thyroxine, like that. So these all hormonal regulation and endocrinal regulation comes under the purview of Pitta dosha. And the etiological risk factors related to hypertension. So next we can go to the what are the etiology, nidana factors of the hypertension. We know that the high salt and spicy food intake, alcohol consumption and use of tobacco, low calcium and potassium intake, this and psychological stress, all these things in Charakam Sutram, I think 22nd chapter, this Pitta Vada and also the Rekta Visheshan, all these factors we can see, and Rekta Dushti also by this Nidana. And the physical inactivity, dullness and habitual intake of fatty foods, that may be the reason for the Kabha and Medo Vardhaga Nidanas. And the third one, the family history, that is due to the Bija Dosha, genetic defects. And the fourth one, Rekta Dushti Karna by Charaga in the Vidhi Shonidya Madhyaya, that is the 24th chapter of Charagam Sutram. So we can see all the three doshas, Pitta, Vada, and Rekta, Kabha, and also Rekta Dosha, all and family history, Bija Dosha, all are involved in this etiological factors. And based on this, we can decide the treatment also. And the pathology of hypertension in Ayurveda based on the modern view. So the impaired functioning of the autonomic nervous system causing the rise in blood pressure we can correlate with the Dushti of Vada. If the Nidana is due to Vada, this autonomic nervous system, something related to nervous system, so it is Vada Pradhana like that. And if any hormonal imbalance and anything like that, endocrine disorder, it can correlate with the Pitta and Rekta Dushti, and Adhikadu, Adhilavana, Rasasevana, all things can be that correlation. And increased functional vasoconstriction due to impaired hormonal function, that is the main reason for Pitta Dushti due to endocrinal defects. And the third mechanism is due to the defects in the vascular smooth muscles, that is atherosclerotic changes caused by the factors like hyperlipidemia. And this purview can be included in the Visheshna of Kabha Dosha and Medo Dushti. I think clear. So this is the pathology. I think we can mainly classify the Nidana into two factors, genetic and the psychological factors. And we can see the Rekta pathway, Pitta pathway, and Vada pathway and Kabha pathway. Okay, and okay. Due to the time, I am. If it is speed, you can tell. Don't worry. So the Nidana factors we can broadly classified into genetic and environmental factors, and also the psychological factors. And among these, we can the dosha base also we can see a defect in the renal sodium homeostasis. That Rekta pathway we can see, and Pitta pathway similar to the hormonal and all the things, and Vada Visheshan if any nervous involvement is there, we can correlate with Vada dosha, Vada pathway. And if there is any fat atherosclerotic changes and anything like that, hyperlipidemia like that, we can correlate with the Kabha pathway. This is the genetic and environmental factors. And psychological factors also, excess worry and fear, that can be correlated to the Vada Pragopa. And if the anger and stress, that can be correlated to the pitta prakopa, and dullness and inactivity, that is kapha prakopa. This the psychological factors also we can correlate in the purview of three doshas. Clear? And the types of hypertension, that is primary hypertension and secondary hypertension. You know that all the things are essential hypertension, which is otherwise known as the high blood pressure, that is not due to the another medical condition. There can be many causes, including obesity, family history, and unhealthy diet. These all the things can come due to the primary hypertension. That is mainly develops after the age of 40 without any demonstrative cause. Environmental factors, genetic factors, all things may be the reason for primary hypertension. And if there is any underlying pathology, that is secondary hypertension. And these are the signs and symptoms. I will tell one by one. Early signs and symptoms, and also late symptoms are also there. So the early signs, we can see the fatigue, giddiness, headache, ringing in ears, insomnia, lack of concentration, like that many features we can see. And epistaxis, hypertensive retinopathy, stroke, congestive cardiac failure, myocardial infarction, renal failure are the chronic effect of this later stages of symptoms of hypertension. And now we can go to the symptomatology and with the Kriya Kala. So mild to moderate hypertension in most cases does not exhibit any symptoms, but if sudden and severe hypertension produces symptoms like headache, giddiness, palpitation, excessive sweating, fatigue, exertion, dyspnea, and insomnia, and the Srodho Vaigunya, structural changes also occur, that we can comes under to the Vaigunya, Srodho Vaigunya purview. And if we are not treating in that time, it will affect the trimarma, eyes, and also the blood vessel. That means it will sthana samsraya occur. And if more lakshanas and all the things are seen, it is vekta, that is symptoms are seen. And bheda, that is a complicated stage. There occurs the severe damage of these organs, making the disease asadhya, incurable, and sometimes leading to the death itself. So based on the Shatkriya Kala, we can stage all these symptoms. So now we can go to the principles of management of hypertension. Nidana factors and the Lakshana, and also the Kshatriya Kala basis, all the things we covered. Now we can go to the principles of management. So the first thing is avoiding all the etiological factors of disease, that is correction of lifestyle, diet, etc. is proven to reduce the risk of coronary heart disease. And we know that in Ayurveda, Dinacharya, Rudacharya, Matra Shidya, Navegandharanya, Sadvrata, all the things are particularly dedicated to healthy lifestyle. These include the harmonious living pattern by deeper understanding of human life and its interaction with the nature also. And in general, reducing the body weight, stop smoking, healthy diet, and also increased physical exercise are routinely recommended by most of the physicians. And Tridosha and Rasa, Rekta, Medho Dushti should be in consideration while treating a hypertension, and along with the Vadanulomana and also Tridosha Hara and also Rasa Rekta Prasadana, blood purifying, like that treatment will be more effective in the principles of management of hypertension. And I will tell one by one in the Ayurvedishala way of treatment of hypertension. There are many treatments. I will tell one by one. We are doing many treatments for hypertension, and also if something cardiac, any problem is there, we are treating with Uropija with the Dhanantaran Thailam, one of the method, and Thaila Dhara with the Kshira Bala, and also Bala Guluchati, like that Thailam we are Indra Prasadana, like that Thailas we are using for Shiro Dhara, Thaila Dhara. And in home also we can practice this type of Shiro Piju also we can apply, we can use in home also if hypertension is there, along with the Shira Bala or Bala Guluchade we can practice. And here we are practicing one other thing is Talam. Talam means making a paste with that powder churna and this oil, like Kachuradi and Shira Bala. Evening time, 1 hour we are usually practicing, and the BP will sudden reduce also. We see that in our experience, we can see that around 180, 190, like that cases also, by applying this talam, the BP reduced, Kachuradi along with the Shira Bala, like that. And Similarly, the Panchagandha Churna plus Shirabala is also we are practicing as a talam in Ayurveda Shala, and periodic Virachanam we are practicing. And if then we are going to the according to the symptoms we are practicing and what are the organs involved, we are practicing the treatment of hypertension. If pedal edema and urine motion are shodhana is not proper, urine and motion are not excreting properly, we are giving for Dasamula Haridagi Leham and also Chandraprabha Vadiga, like that. Along with this medicine, we are giving the hypertension, Ayurveda hypertension medicine like HT Kotuga Rajanadi, like that medicines we are also practicing. So considering the system also like that, if any cardiac involvement is there any other problems of heart problem, and also those Shodhana treatment is needed, we will go for Rasonadi Kashayam along with HT code. So along with HT code, we are giving Rasonadi Kashayam also, and Hridaya Raksha Kashayam, that is a special medicine that available in here also in Kottakkal area only, but Rasonadi Kashayam is available in market. And if any renal involvement is also there, if the BP, if the hypertension is due to the renal involvement, we can go for Brihatyadi Kashayam, Chandraprabha, along with we are giving HT coat and also Sarpagandhadi tablet and many other medicines also, considering the symptoms. Okay. And if the disease is due to the endocrine involvement, we are mainly go for the Punarnava based medicine like Sukumaran Kashayam and also Punarnavadi Kashayam, like that medicines also we are giving, and Punarnava extract 2 gram. Punarnava extract also we are giving. If the endocrine involvement is there, thyroid, like that problem is also there, we are giving such type of medicine. And if the BP hypertension is due to non-steroidal anti-inflammatory drugs induced hypertension, we are giving mainly for the blood purifiers like Shonida Amradam Kashayam, that is mentioned in Kushta Chikitsa Fashtahridaya, that is Rekta Prasadana as a Rekta Prasadana. If the we are considering the Nidana factors also, if the patient is taking Kadu Amla Lavana Ahara and also Vidahi Ahara, we are giving such type of Shonida Prasadana, Rekta Prasadana medicines also. And if the disease is due to the neurological causes, we are going for Ashtavarga Kashaya, like that Vadahara Kashaya, Ashtavarga, Badradi Kashaya, Badradarvadi Kashaya, and along with HT coat we are giving. And hypertension should be Hridya. So along with Kushmanda Rasayana, Thalisa Vatradi Churnam, and Vidharyadi Kashaya, if the patient is lean, we are going for such type of medicine, because Vidharyadi Kashaya, which is mentioned in Ashtanga 15th chapter, Sutrasthana, Vidharyadi Ganavada Pittahara. So patient, according to the bala of the patient and according to the symptoms, we are usually practicing such type of medicines. So our former managing trustee, P.K. Varya sir, there's a very good combination of medicine, that is Guguliditang Kwadam or Kashayam, and along with Indugandam Kashayam, with the Hridayanava Guliga for hypertension. That is not only for hypertension, for all the arrhythmia, irregular pulse rate, and all the disease related to heart, he used to give such combination, and it gave very good result also, this combination, Gugulitham Kashayam, Indugandam Kashayam with the Hridayanava. Now we are practicing this tablet also, Gugulitham Kwadam tablet, Indugandam Kwadam 2 Gugulitham tablet, and Indugandam 1 tablet, and Hridayanava 1 tablet, morning and evening. We are also practicing for all the heart cardiovascular diseases. We are practicing this medicine. It is giving very good result also. Very Dashamulam is one of the important preparation in many ways. That is Dashamulam Kanyi. Kanyi means porridge. 15 gram Dashamula powder powderly we are giving to the patient. And along with the Dashamula, if not possible, we are giving Dashamula Panyam 1 liter for 1 day, like that, or 2 liter, like that. We are giving if high BP, hypertension is more. Then Rasayana, we are giving Tipali Churna 1 to 2 gram, along with if there are any Kashaya, we are giving with that medicine 6 a.m., 6 p.m. And Lashuna Chiram we are also practicing, and Tripaladi Churnam, Shundi Churnam, and also the main thing, Parthyarishtam also we are giving for all the cardiovascular diseases, and also Arjunarishtam or Parthyarishtam we are practicing. These combination are giving very good result in hypertension. And this is the first portion of my presentation. And we done a study in hypertension of HT code, that cross-sectional survey to assess the effectiveness of HT code among Ayurveda medical practitioners across India. This is the second portion of my presentation. So in this study, this is our medicine HT code. HT means hypertension, code means cortical. So HT code tablet. So these are the major ingredients of HT code tablet, that is Jadamanchi and also Sarpagandha and Rudraksha. These are the things in this article. Introduction, methodology, observation, analysis, and interpretation of the survey, and discussion and conclusion. So all these things we already covered. The concept of Ayurvedic concept of hypertension, all the things, because it involved tridosha and all the things already we covered. So I'm skipping this. Then so the second portion, that is methodology of the study. So the objective is to assess the effectiveness and added benefits of HT code. This is our objective. And methodology we've done. The materials, primary sources, we took references from Brihatrayi, Laghutrayi, and all the available commentaries, and also the secondary sources from all the published research papers, and also data available in online also, and all the thesis, journals, articles, all we collected for getting Sarpagandha related hypertension, all the things we covered. And this is the study, and we done after preparing the literature review of hypertension and also the Ayurvedic view of hypertension. And after preparing this one, we prepared a questionnaire, and it contained all the steps of development of the questionnaire, like phase validity, content validity, and all item generation, item selection, like that. All the steps of questionnaire development we completed, and done the phase and content validity. Here written only phase validity. More than 80% of the contents were agreed by the experts. Clinicians were more than 25 years of experience to doctors. And after preparing this questionnaire, we done survey in different parts of country. And after taking 128 observations, we take this analysis and conclusion of that, sorting of all the data, and we prepared an article and published in an international journal also, peer-reviewed journal. I will tell one by one. So HT code contains the 3 ingredients, all the things covered, and a descriptive cross-section survey was done among Ayurveda physicians in different parts of India. And out of 128 physicians, the 84 physicians having more than 20 years of experience to doctors. So their opinions are very important in nowadays, because we need such type of study. That observation and also the qualitative study is needed in the present scenario. And we done the conduct of survey. The design is a descriptive cross-section study, and the involved doctors age group is 20 to 80 years aged doctors we included, and persons who are not willing to participate we excluded. And the sample size calculation by this formula statistically, and data collection by primary collection of data with a structured questionnaire through the Google form, and statistical analysis, all the statistical analysis possible, cross-section study, prevalence in diagrammatic frequency and percentage, all the things done, and cross tabs and chi-square test also done. And the third part of the study, that is observation, analysis, and interpretation of the study. Here we can see that in clinical experience to doctors, here out of 128 responses, 128 doctors responses, 84 doctors, that is more than 68% of physicians having more than 25 years of experience to doctors, and that's important. And I think 33% of doctors having more than 20 years of experience to doctors. And the cross tabulation, I'm showing slight small things only. In the cross tabulation, we can see that in this we can see that the effectiveness of HT code and also hello, Jidin, is it audible?
Yeah, it's audible.
Okay. And in the cross tabulation, we can see that the effectiveness of hypertension and the effectiveness of the medicine in one part, in the above part, and in the left side we can see the experienced doctor's opinion. So we can see that the 73 doctors opine that it is very effective in stage 1, 2 hypertension, and also in other conditions also it is effective like that. And moderate action, around 48 doctors also opine like that. So we can see the moderate and very effectiveness we can see in the study. And HT code, that is mainly we are using for hypertension. But before preparing the HT code in Ayurvedishala, this medicine used as Ari Rudrakshadi Churnam. So that is the main content of HT code is Jadamanji. So that medicines we are giving for some mental related problems also, some disturbed sleep, some sort of anxiety like that. So we suggests this medicine is good for hypertension. Also, it reduces nervousness and also anxiety like that. So we took that opinion from the doctors also. So we can see that systolic and diastolic pressure it giving very good result, and reduces the nervousness also it giving result, and anxiety also 59% of the doctors opine like that. And the cross tabulation of HT code tablet and effectiveness of HT code, we already mentioned the effectiveness in systolic and diastolic hypertension like that. We already mentioned 126 physicians having experience in treating all the four conditions by in its effectiveness is very effective like that. All the doctors opined. And systolic pressure, I think the out of 128 physicians, 73% of the doctors reported that HT code is more effective in stage 1 hypertension and stage 2 hypertension. Around more than 60% of the doctors opened in stage 2 also. So along with HT code and Gorojana, it giving very good result in high BP like that. Okay. And the chi-square test also we done the test for association of stages of systolic blood pressure and ideal time of HT code giving very good result. With a p-value 0.001, which is less than 0.05. So it is statistically also it is significant. And in stages of diastolic blood pressure also in stage 1 and 2 also it giving very good result. I'm not telling the entire data because 72 like that percentage doctors reported. So next we go to the what are the conditions it giving very good result. So HT code, we took diabetes plus hypertension patients, or obesity plus hypertension patient, stress plus hypertension patient. So we got majority of the doctors opine that HT code giving very good result, more effective in stress plus hypertension. 99 doctors, that is around 79% of the doctors opine that HT code giving very good result in stress plus hypertension. So that is all the hypertension, most of the patients having some stress, job stress, family stress, all the things are there. So it is giving in almost all the BP patients, it giving result because they are getting good sleep. We know that Trayovastamba, Nidra, Ahara like that. So while taking HT code, they are getting very good sleep also. So the BP and all the things usually done. I will give the discussion portion. I will explain all the things. And best time for administration by the experienced doctors, they are telling that HT code giving the ideal time of administration of HT code is after breakfast and dinner. That is more than 50% of the doctors opine like that. Physician opine that the ideal time of taking HT code is after food. So here also the chi-square test telling the test of association of effectiveness of HT code and also the ideal time that already we mentioned. And in pregnancy also here 17 doctors opine that they are giving this medicine. Pregnancy hypertension also they are giving, because that 17 also important because these doctors gave this medicine in hypertension in pregnancy. They are giving they are getting result also. So the main thing, the added benefits of HT code. So along with other medicine, HT code giving very good result. That other problems also, if we are giving HT code in mental disorders, is there is any mental involvement, manasika involvement, anxiety like that, along with the Drashadi Kwadam. Kwadam means tablet, Drashadi Kashai or Drashadi Kwadam with HT code giving very good result. Okay, and also in headache, if the headache is due to some stress related, along with HT code, Migra code also giving, Migra code plus HT code giving, this combination giving very good result. And in fatigue also, along with ashwagandha tablet, HT code giving result. And the sole use of HT code giving improves the sleep also. So the disturbed sleep and all these conditions, because Mansamitra tablet and all the things having some rate is some high. So HT code giving, I think it will be the drug of choice for the sleep disturbances and all the things. And here, 2 or 3 patients with irregular heart rhythm and high BP, we gave the HT code along with Gorochanadi Guliga. It gave, I think, around 180, 190, that systolic BP. With the Gorochanadi Guliga, it is giving very good result. With the 2 days, the patient's feeling symptomatically very good relief, and also the BP also reduced. But we know that all the conditions we should monitor, chikitsayam pradhanam to avasthana vidhanam, all the conditions you should kept in mind. And but these are the results we obtained. And this HT code, other action, it is improves the sleep, and it also reduces the hyperactivity in children also. So in ADHD also, we are giving this HT code. And the thing is, because the main thing is the Jadamamsi. And here Kottakkal, there is a government mental hospital in Kerala, only one mental hospital in the government Ayurveda area, that is in Kottakkal Mental Hospital. There the doctors of this Manasika PG doctors, they are using this HT code for all the Manasika related problems also, because and anxiety and also sleep disturbance and all the problems, they are giving HT code also. Okay. And reduces the depression and condition of hyperacidity. These are the some additional observations we obtained from the study. And so the discussion, we can see that hypertension is a psychosomatic condition because it involves all the stress and all the related, and also the sharirika and mansika bhavas involved in hypertension. So the stress of daily life, emotions like fear and anger, also contributing factors, adds to the cause. So modern busy lifestyle plays an important role in the etiopathogenesis of hypertension. And when we go through the contents of the HT code, it contains mainly Jadamamsi, Sarpagandha, and Rudraksha. So Jadamamsi in text it is Tridoshahara, and Vada Kabahara, Sarpagandha, and Rudraksha is Vada Pittahara, like that we can see. So the main cause of HT BP, we know that Tridosha involvement is there. So the main ingredient of HT code is Jadamamsi, that is 200 mg, we can see. So it is a Tridoshahara medicine. And Vyanavada, Sadhaka Pitta, and Avalabhaka Kabha, we can, this Tridosha, we can control by giving this medicine, because Jadamamsi has action in Sadhaka Pitta also, because the Manasika involvement, we know, Abhipradartha Sadhana, Sadhaka, like that functions we know, and which is situated in heart related to the mental function. Chakrabarni explains that Shaurya, Bhaya, Krodha, Harsha, Moha, and emotions connected with the heart, which has direct impact on blood pressure. And the major ingredient of HT code is Jadamamsi. In various studies, it shows that the tendency to affect the functioning of Manovaha Srodhas, as per the survey, HT code shown marked effect on anxiety and allied problems. And along with the Drakshadi Kwada, there is a very good result, because it is Pitta Vada Shamana also. And we know that Jadamamsi, there are many studies happened, antioxidant, anti-stress property of Jadamamsi, because it contains
Sir,
the
you are
antioxidant.
not audible.
Not audible?
No, it's audible.
No audible, madam?
Audible and audible.
Okay, okay. The antioxidant and anti-stress property of Jadamamsi explained on the base, because it contains the flavonoids and polyphenols, that already the study done. So these ingredients giving very good results in Tridoshahara and also Pittavadahara action, all the things. And the next discussion portion is by Veshajakala. Why these doctors are telling that after food it giving very good result? We all studied the Veshajakala, ideal time for consuming, that is the Veshajakala. And in Vyanavada, the main thing is Annamdo, that is after food intake. It will be very ideal. So while taking HT code after food, after breakfast and after dinner, giving very good result, like that we can correlate. And the above survey indicates that the ingredients of HT code tablet have an effect on both Sharirika and Mansika doshas, and concluded that HT code tablet contain effectively in the long-term management of hypertension and associated conditions like anxiety, restlessness, and Manovaha Srodha Vikara, and improving the quality of sleep, like that. So now I'm going to the conclusion. So the thing is, out of 128 physicians, 86 doctors having more than 84 doctors having more than 25 years of experience, doctors, and 86 more than 2 doctors that missed. And HT code is very effective in the management of systolic and diastolic pressure, stage 1 and 2, and It plays an important role in the management of nervousness and anxiety. The combination of medicines giving very good result in stress-related hypertension and also control hyperactivity in children. And the combination therapy of steroid giving very good positive result. And ideal time for consuming HT is observed to be after food, and the statistically significant p-values that also that mentioned in the conclusion. And these all things published in IGLSRA, International Peer-Reviewed Journal, and which is indexed in close reference and index. And we can see that in ResearchGate, it is around 2036 reads already happened. This is a brochure, and these are the references. And now we can conclude. I think thank you for the patient listening, and thank you, Jidin. Thank you, Jidin.
Thank you, Dr. Anup. Oh, please. Anup, കേൾക്കാനല്ലേ?
കേൾക്കുന്നുണ്ട്. Presentation is over.
Yeah. If anybody have any doubt or any more clarification or any suggestion, they can raise that, please. Dr. Anup, can I add a point?
Hello, sir. Hello. Good evening.
Yeah,
Hello.
yeah, please.
Good evening.
Yes,
Yeah,
madam.
sir, to explain Google Tiktadi Kashayam and Indukantam tablet. So how to
Your
give
voice
that?
is not clear, madam.
Sir, you said Indukantam tablet and Google Tiktadi Kashayam. In what conditions we can give that? Hello. Can you hear me, sir?
Indukantam, Google Tiktagam and Hridayarna Rasam.
So, in particularly in hypertension or hypertension along with the heart patients, cardiac patients.
Both. Hypertension in cardiac patients.
They are being rushed, Indukantam, Google Tiktadi, and one more thing you said, sir?
Hridayarna Rasam.
Achha. So, how long?
It can be given for 1-2 months. Then you have to monitor the BP and of course the cardiac measurement also.
So no need to get HT cot along with that?
If you are giving Hridayarnasam, and this one, Indukandam, then you don't need to have this in the HT cot tablet.
Thank you, sir. Thank you.
Either way is fine. Thank you.
Sir, good afternoon. Sir, want to discuss one case.
Sorry?
Hello.
Yeah.
Sir, my voice is audible.
Your voice is not clear, madam.
Wait, sir.
Hello.
Hello?
So there is some range issue, madam. Sorry.
Hello?
Clear? Yes,
Can
yes,
I
madam.
audible?
Yes.
Hello, sir. Very nice presentation, sir, and useful also.
Hmm.
One
Thank you, ma'am.
patient
Thank you.
I have, 57-year-old male patient. He has a history of hyperlipidemia. It means high triglyceride and high cholesterol also. Since 15 years, and hypertension also on allopathy medicine he is. But I am giving him for all these sign symptoms. Now triglyceride and cholesterol is normal. Triglyceride is reduced up 360, and antihypertensive allopathic medicine also reduced half dose. What will be the future approach, sir, Ayurvedic approach? How can I manage? Periodically, I am giving Virachan also, and giving Rasapachak, Raktapachak like that medicine, and some Sutaganda, it means Sarpaganda tablet also. In hyperlipidemia with hypertension, what will be the approach?
There are many medicines, madam. We can usually we are giving Gugulu Panchavala Churnam along with the Yogaraja Churnam for hyperlipidemia, and for controlling BP, we are giving HT code like that medicines also. We are providing like that, and in according to the symptoms and also the avastha patient condition, we are giving such medicine, and we will monitor within for the next 2 weeks like that. After that, if needed, we will change the medicines also like that. We are giving the medicine. Okay.
Panchatiktak and Yograj, no?
Guggulu Panchavala Churna plus Yogaraja Churna. That is a very good combination for reducing the hypercholesteremia.
Panchavalka, no?
No. Gulgulu Panchapala Churna. Ayurvedic preparation. Gulgulu Panchapala Churna plus Yogaraja Churna. That is a very good combination. And Kabamedohara medicines like Varanadi, like that also we are giving.
Anyone else?
Jiten, please.
Okay, thank you, sir.
There is some range issue. I am not hearing properly. Sorry.
Hello.
Yes.
Hello.
Yes, sir.
Namaste, sir.
Namaste.
Sir, if a patient comes in acute hypertensive attack, that means the BP shoot up to about 200, and he's been hypertensive since many years, around 10 to 15 years. He's in allopathic medication, but suddenly one day the BP shoots up around 200 and above. So if he comes to us for Ayurvedic approach, what we can do?
For sudden reducing BP, we are usually giving this talam, Kachuradi Churnam plus Shirabalam. That is one of the method. And also we are giving some, if is emergency situation, we will refer also, because but before referring, we are giving this talam and dhanandaram tablet below the tongue, like that we are giving, and this medicines also, HT code plus Gorojanati, like that we are giving. So usually it will reduce within, and symptomatic relief also usually occur. And if any symptom like any other things happen, we will refer also like that. Okay. I think Jiten can tell more.
Hello, sir.
Yes, sir. Yes, sir.
First of all, we have to see the how much the BP value is increased. If it is 200 more, it's better to refer the patient. We can't manage emergency situations with Ayurvedic medicine. You better know that. But for a symptomatic relief, for a long time treatment, we can manage with allopathic medicine. And we have to monitor the BP, so we can taper the dose of allopathic medicines. In that way, we can manage hypertension.
Okay, sir.
The talam you understood, no? But doctor has mentioned the talam.
Okay.
We have to make a paste of Kachurai Churna, we have to apply on the vertex.
Yes, sir. I'm aware of it. Yeah. So one more question.
Yeah.
Sir, if a patient is newly diagnosed with hypertension, that means he is not on any of the medication, and just by accident finding we come to know he's hypertensive. So in that case, is it possible to do only Ayurvedic treatment, and it can be management completely by Ayurvedic medicines?
It can be managed, but the diet also has to be restricted.
Okay.
Right.
Sir,
Even Dasamola Daswanadi Kashayam also would be more beneficial to be added with HT code. And Punarnava contain medicines. Yeah.
Sir, is
Yes,
it
sir.
possible that after some days of Ayurvedic medication, his BP problem will be cured fully?
That we can't assure, no, sir. Yes, Dr.
according to
Anup.
the patient. Yes.
No, that, I just want to ask, that means many of the time patients ask ki whether by Ayurvedic medicine we are going to get complete cure or we have to continue with the medicine lifelong.
Not like that, sir. We should
The-
monitor the patient always, because there are many results while taking this HT and there are symptomatically, and also his body feeling very lightness, and also that all the daily activities will be improved, and sleep will be improved. Then that all the things will improve. So accordingly, we will check the BP and we will reduce the dosage also, and we will slowly tapering on. That is a method we usually following.
Sir, if you can share with your experiences ki whether after some time of treatment the patient can go without medicine rest of his life.
We allopathy medicine slowly we reduced, and we included our medicine, Ayurveda medicine, and after 2-3 months taking this medicine, slowly we can taper the dosage also, like that we see, but in the younger age patients. But I think after 60, like that, we cannot tell completely like that. I think we can discuss with Dr. Jitin also, because Jitin, am I right?
That will be, yeah, that will be difficult. Age is also a factor. Comorbidity is also a factor. Food habit,
Yes.
and of course lack of exercise can
Yes.
also increase the BP.
Sir,
The same question we will face is the diabetic case, right? In your practice, you might have
yes,
faced that question also.
yes, sir, yes,
Is
sir.
it
Because
reversible?
the patients ask directly if he continue the treatment for rest of the life, then why he should go for Ayurvedic? Why not for allopathic then?
The allopathy can cause some side effects, especially
Okay.
pedal edema.
Yes.
Ayurvedic
Why-
will not be there.
while
Again,
take-
some risk factors. Yeah. Yes, Dr. Anup.
No. You please continue. Here are some disturbances. That's why. Please, you continue,
Okay.
sir. Continue.
Again, as I told about in diabetic case also, we face the same question. So what I used to say is, if you have a poor vision, you have to wear a specs. But even with specs, you can live a normal life, right? The same way is BP and diabetes also. You have to take the medicine. We can't reverse that, but you can live a simple normal life with the medicine.
So
Yes.
can we confidently assure the patient that instead of going for allopathic medicines, continuing with the Ayurvedic medicine is a better option?
Yes, sir. The method is we should take both the medicine, and slowly we can reduce the allopathy dosage. And this HT code and this Gorojanadi, or our Ayurvedic medicine, according to the condition, if the BP is due to the cardiac involvement, or if the BP is due to the renal involvement, accordingly, if we are giving the medicine, then the quality of life of the patient will improve. So slowly he will be okay. Slowly he will get a result also. Then we can complete stoppage of the medicine. All this possible, but we should monitor the patient. That's the main thing. And the thing is, in text also it is mentioned that chikitsayam pradhanam tu avasthana vidanam. According to the condition only, we can give the medicines, diet, all the things are important. Okay,
Right, sir. Right.
Hello.
Sir, hello.
please, madam, please.
Sir, I want to discuss one case. Sir, one of my patients having hyperacidity since childhood.
Hmm.
Then afterward, after marriage, patient got migraine with aura. I consider her lakshan in a pitta shirashu. Then within a 1 year back, she got a menorrhagia, and uterine fibroid was there. Heavy bleeding was there. So patient took some medicine. Afterwards, she got like a feeling of hypertensive. BP got higher. So she's taking hypertensive medicine also and migraine medicine also, but sometime. But she is around 36. So how we should manage this type of cases when multiple things are here, like patient is having a pitta shirashu, and like I told you all the history of the patient.
Yes. Madam, there are many things. We know that in Arsho Samprati Ashtanga Chikitsa, the involvement of the Vada Abanavadu Vaigunya, we can see that from simple constipation to up to anthyam, that means blindness. There are many
Yes, sir.
symptoms we can see, around I think 44 symptoms we can see. So the Vadanilomana, and also there are some hormonal issues also there. So along with the Vadanilomana plus this hormonal issues, Sukumaran like that Kashayam, with some symptomatic medicines, H-T-Coat or BP reducing, and we are not giving same medicine for long time. After 2 weeks, according to the condition, we can slight changes also we can give, and by stopping the rasa, like that we are prescribing the medicine, madam. Okay, so we cannot
So
say.
we can give HT code. Like I have started with, I'll tell you. I think this patient
Yeah.
is gonna
No problem, because HT code she can take. Yeah, Pitta
Pitta.
involvement is there, Jadamanji is also, and also there are stress involvement is also, so she can give HT code, and these medicines also, this Sugumara, like that. I think hormonal issues are also there. So considering all these conditions, we can give the medicine. Vyadhi Pratyaniga medicine we can give. Okay. Then because we know that first for treatment, first we look the symptoms. So symptom, Rupa is 5 among the thing, Roga Parisha, Nidanam, Pragrobhan, Lakshana, Upasham, like that. So symptomatology we are treating is only the 1/5 of the treatment, and avoiding the Nidana factors, and then only we are Samprapti Vigadana, like that. What are the involvement of others? What are the like the Dushya, and according to the Prakriti, then only the Samprapti Vigadana happen. And I think Jidin also has more opinion. Please, Jidin.
And Nidana Parvati is the first thing.
First thing.
The Padhanilomanam should be done the first of all. So later on, all the things will get down.
Yes.
Will get improved. The acidity and the energy, everything will get down. First, once the Padhanilomana has treated. Right?
Yes.
Hello.
Thank you, sir.
Thank you.
Hello?
You. Yes, madam.
Sir, for how long we can take Ashticot? How long? Like
Same,
telling
madam.
they are taking whole life. So Ashticot we can take like that.
We can monitor. I think we usually 21 days, 45 days, we are giving this medicine, and we will monitor, because after that, food be medicine will like food. Satmya will occur. So it should be a break, and then only we can continue like the medicine. Checking,
like that.
yeah, according to the condition, and also how monitoring the BP, like that we can reduce the dosage. If she is taking two tablet per day, we can reduce to 1, and 1 day gap, like that we can reduce the dosage also. Okay, so and if BP is more also, if needed, the allopathic medicines also she should take. That according to the condition. We cannot say this medicine for 2 weeks, for 5 days, not like that. I'm not sure. But
No, like
we are,
in allopathic, they make it compulsory to take Telma or whatever medicine, they make it compulsory, whether the BP is normal or not. You keep on taking all the things. So we cannot give HPG got like this.
we can give HT code and that amlodipine regularly, and the patient immediately after taking 2 weeks medicine, they will tell that they are feeling better, like that. So we can reduce the allopathy dosage, and like that, because the patient feeling that
Without allopathic doses, sir, without allopathic.
Okay, then HT code she can take, and not only HT code, Sarpagandha Guliga, Gorojanadi Guliga, there are many medicine. Arjuna, this Talam also, if BP is very high, we can go for Tala, because it can be practiced in home also. There are many methods.
We can take, how long we can take HT code? If the BP is even normal, she can give, they can take on, keep on taking the medicine.
HT code has many other actions also, because it is Arya Rudrakshadi Churna that made into a tablet, like that. So this Arya Rudrakshadi Churna has disturbed sleep, and also all the
that I got, sir.
Yeah,
so how long we can take? How long we can take?
That according to the, usually we are giving this medicine for 2 months, like that.
2 months, sir.
And after that, if needed,
sir.
yes, madam.
Sir, you said you after recording the BP, you can stop HT code and you can start. You said you will have to change the medicine, or else they'll become addicted to that medicine or satmya to the medicine. So when we stop HT code, what else medicine we can put in between before restarting HT course after few weeks? What medicine can we prescribe them?
We will monitor the patient, madam. The thing is, if every week they should check the BP. If BP is normal, we can reduce the dosage also, not the satmya like that. She can reduce the dosage, and if needed, sarpagandha tablet we can, if needed. Otherwise, no problem, like that.
Sir, but what happens if we recheck the BP after few weeks? If it has raised again, we may have to start HT course again. Okay.
We can take 2 tablets 2 times like that, or we
So
along with
in between, in between to maintain, in order not to raise BP, what can be given?
If not raising the BP, what the medicine given?
Yeah.
Then we will check the symptoms. What are the things, other things she has? If Vada and Lomana is only needed, Ashtavargan Kashayam we can give. If any other things is needed, endocrinal problem is there persisting, like that Pitahara medicine like that we can give. That according to the symptoms and also according to the condition. I think Jidin, is there any? I don't know. Jidin, please.
No, Sarpagandhadi and Gobi Chandanadi would be a good combination.
Yeah.
That can reduce the BP up to some extent if you are stopping HT course.
Okay, these medicines for how many days it can be given continuously?
What I understood is doctor was saying, if you are giving any medicine, not HT course, whatever Ayurvedic medicine you are giving for a long period, it will get used with his body, his or her body. The body will consider the medicine as a food. So it will not give its action to his or her body. So that's why the doctor has, satmya. That's why the doctor has to give a break for that medicine. 1 month or 2 weeks or 1 month, whatever. But in that period, the doctor has to monitor the BP of the patient. If the BP is shooting up again after stopping the ST code, so the doctor has see the symptoms. Apart from the hypertension, if there is any other symptom, the doctor has to give symptomatic treatment. If it is not there, only BP is shooting up, you can give Sarpagandhadi Guliga. If it is not working, you can give Gobi Chandanadi along with Sarpagandhadi Guliga. That will definitely work. In my experience.
Yes. We do not give all the medicines all the time. We should next condition Rasayana, first condition Divana Bhajana, and in skin disease Kapavitta Shamana, then Srodo Shodhana, then last Rasayana like that. Then only the treatment will effectively we can manage, and the patient will get more result also, I think. Okay.
I think even
sir, thank you, sir.
Thank you. Virajana, periodic Virajana, because in Charagam Siddhi it is because Charagam Siddhi it is given Manaprasadam, Buddhi Indriyana, like that. The Virajana effect we can see like that. There are many indications by giving periodic Virajana.
Sir, example, if a patient has BP and with HT course, it has come to normal. After few days, I stop HT course. So in order to not reverse again, BP should not be reversed. Chandra, what medicine can I suggest to prescribe the patient?
That's what we told, madam. If you are giving HT code 1 BD to a patient and it has come down marginally after giving that medicine, you can reduce 2 tablets in a day to 1 in a day.
Yes, sir.
Okay. Then taper that. Then you have to stop. Even after stopping the medicine, the BP still shoots. So you can give Sarpagandhadi. If it is not working, you can give Gobi Chandanadi along with Sarpagandhadi.
Okay, sir. Thank you, sir.
Okay. Anything more?
Good evening, sir.
Good evening, madam.
Sir, what about the hypertension which is caused by kidney disorder, any secondary hypertension? Can you please guide us?
Yeah, madam, in kidney involvement, we are giving, there are a lot of medicines in Ayurveda Shala. We are giving Vrishadanyadi Kashaya, Brihatyadi Kashaya. These are available. Brihatyadi Kashaya is available in market also. So considering that condition, what are the symptoms of kidney and the report also, we are giving Brihatyadi Kashaya plus Chandraprabha plus reducing the hypertensive medicines